My name is Dr. Eitel Oppenheimer. I'm a general and bariatric surgeon, and I practice at the HCA Florida Ocala Surgical Group. So we take care of patients who have problems regarding general surgery, and we also take care of morbidly obese patients who need metabolic surgery. We offer a variety of interventions, including hernia repairs, gastrointestinal surgery. We see that patients are taken care of and informed before surgery. We receive referrals from primary care practitioners for patients who have general surgery needs, as well as patients who are morbidly obese and interested in weight loss surgery. One of the things I enjoy about my practice is being able to deliver state-of-the-art care to patients using the robotic console. I think it's an instrument that aids in offering good patient care, and it enhances my ability to perform my interventions. I find patients who have robotic surgery tend to have less pain, and they recover faster from surgery because that's a procedure that's minimally invasive in nature. So it's one of the benefits of having surgery with that form of technology. It is also one of the reasons why I pursued training in minimally invasive surgery. Patients recover best from an intervention. I also give patients the opportunity to talk about other things that may be related to their concerns. It's really compassionate human care that we're delivering to patients. It's not just the science and the craft of surgery, but it's also human interaction.